we're going to be doing our full sideline assessment. This is called the SCAT5. It just gives us a more in-depth kind of assessment of what's going on. So before we get into everything, I just want to ask you a couple questions about your background. So what is your dominant hand?
My right hand.
Okay. How many diagnosed concussions have you had in the past?
None.
None, okay. Have you ever been hospitalized for a head injury?
No.
Have you been diagnosed, treated for a headache disorder or migraines?
No.
Have you been diagnosed with a learning disability or dyslexia?
No.
Okay. Have you been diagnosed with ADD or ADHD?
No.
Have you been diagnosed with depression, anxiety, or any other psychiatric disorders?
No.
And then are you on any current medications?
No.
Okay. So now we kind of want to evaluate your symptoms that you're feeling. So this is post-injury. So what I want you to do is I'm going to give you a list of symptoms here. I want you to read this paragraph just out loud for me, if you can.
This one?
Yeah, just the whole thing.
The athlete should be given the symptoms form and asked to read this instruction paragraph out loud. Then complete the symptom scale. For the baseline assessment, the athlete should rate his or her symptoms based on how he or she typically feels, and for post-injury assessment, the athlete should rate their symptoms at this point in time.
Yeah, so you're going to go through this list here,
Okay.
0 to no symptoms at all, and then 6 for the most severe. And this is just how you're feeling at the time, okay? So go through that, we'll mark it down. Yep. Okay, and then I'll just record kind of the total number and we'll deal with that later. Okay. So we're going to move on to the next part. So this is more of a cognitive screening. So just a couple questions for you. Just answer to the best of your ability. Do you know what month it is?
Yeah.
Okay, what's the month?
March, sorry.
What is the date today?
Oh, the 18th? 19th?
What is the day of the week?
Sunday.
What year is it?
2023.
What time is it right now within 1 hour?
5 o'clock.
Okay. So now I'm going to kind of ask you a couple questions to test your memory. I'm going to read you a list of words, and when I'm done, I want you to repeat back as many words as you can remember in any order. And then for trials 2 and 3, I'm going to repeat the same list and repeat back as many words as you can remember in any order, even if you said the word before.
Okay.
Okay. So we're going to do it 3 times.
Okay.
You ready?
Yeah.
Okay. Finger, penny, blanket, lemon, insect.
Finger, penny, blanket, insect, lemon.
Okay. Finger, penny, blanket, lemon, insect.
Finger, penny, blanket, lemon, insect.
Okay, last one. Finger, penny, blanket, lemon, insect.
Finger, penny, blanket, lemon, insect.
Okay. Just kind of record the score there. So now we're going to kind of do a couple questions with your concentration. So I'm going to read you a string of numbers, and when I'm done, I want you to repeat back to me in reverse order of how I read them to you. So if I say 719, you would say 917.
Okay.
Okay, you ready?
Yeah.
493,
394,
629,
926,
3814,
4183,
3279.
97. I don't know.
It's okay. 62971.
17924. I don't know.
It's okay. 15286.
615886. I don't know.
That's okay. Couple more. 718462.
24. I don't know.
539148.
81493. Oh, I don't know. That's hard.
That's okay.
That's hard.
I know. Now tell me the months of the year in reverse order. So we'll start with the last month and go backwards. So you'll say December, November,
October, September, August, July, June, May, April, March, February, January.
So now we're just going to do kind of like a neurological screen here. So I just want to check to see if you have full range of motion of your cervical spine. So what I want you to do is just look all the way up for me. Is that as far as you can go?
Yeah.
Okay, and then all the way back down. and then side to side. Okay, I'm just gonna actually help you with the movements here. Okay, so just relax, and we're just gonna go all the way back. That's okay? Okay, and then down. No pain there?
No.
Okay. And then just side. Good. Okay, that's okay?
Yeah.
Okay. And then without moving your head or neck, I want you to just move your eyes side to side and up and down. So just your eyes are moving. You can kind of follow my finger, yeah. So don't move your head or your neck. Okay, no issues with that. And now we want to kind of test the ability of you to do finger to nose test.
Okay.
So it's kind of testing your coordination. So just want you to sit nice and comfortably like you are. So you're gonna start with your arm, just one arm, doesn't matter which one, just straight out in front of you. Yeah, just like that. And then 5 times I want you to tap your finger to the tip of your nose and then always return to this starting position.
Okay.
Okay, and you want to do it as quick as you can and as accurately as you can. So whenever you're ready. Okay, good. And now we're going to do a couple of balance tests. So the first one we're going to do is called a tandem gait. So I'll get you to stand up for me. So there would be a line of tape here, just kind of imagine that. So you're going to start with your feet just together like that. And then it's 3 meters long, this tape. What I want you to do is you're going to go heel to toe across the tape. Once you get to the end, you'll turn around and do the same thing back. So just trying to stay on the line as best as you can. Okay, yeah, that's 3 meters. You can come back. Okay. Okay, that's good. We're going to do a couple more balance exams here. So the first one is called a double leg stance. So what I want you to do is we'll take off your shoes and just roll your pant legs up above your ankle. Make sure there's no tape on your ankle or anything. So this test is going to consist of 3 20-second tests in different stances. So the first one is a double leg stance. So you'll stand with your feet together and your hands on your hips with your eyes closed, and you want to try to maintain this position for 20 seconds. I'll be counting the number of times you move out of that position, and I'll start timing as soon as you have your eyes closed. Okay, that was 20 seconds. Good. So the next one is going to be a single leg stance. So if you were to kick a ball, which foot would you use?
My right.
You would use your right. So I want you to stand on your non-dominant foot. So stand on your left foot. Yeah. And then you're going to hold your right foot kind of at just like, yeah, that's perfect. So same idea, you're going to have your eyes closed, and then for 20 seconds, hands on your hips still, we're going to try to hold that position. Okay, so when your eyes are closed, we'll start. It's okay, if you go out of it, just reset and go back to the position, yeah. Okay, and relax.
That is hard.
Okay, so one more, it's going to be a tandem stance, it's called. So you're going to start with your non-dominant foot in the back.
Okay.
And your dominant front foot will be in the front, so just heel to toe. And then just like we've been doing, we're going to try to have our hands on our hips and our eyes closed. And I'm going to be kind of counting the number of times you get out of this position, but we're going to hold it for 20 seconds, just doing the best you can. Okay, and relax. Good. So a couple more, we're almost done. Do you remember the list of words I read to you a few times earlier? Tell me as many words from the list as you can remember in any order.
Insect, lemon, dime. No.
Okay, it's okay. So that's it for our test here. So I'm going to be adding up all of the information, but it has come to the conclusion that possibility that you have diagnosed with a concussion. So we're going to get you in contact with a physician, because they are the ones that are going to be kind of taking us through the concussion protocol and clearing you back to play. So just a couple notes for you. If you notice any changes in behavior, or you start vomiting, or anything's worsening, you get double vision, or you're pretty drowsy, make sure to call your doctor, head to the emergency as soon as you can. You're going to try to limit physical activity, avoid like your Avoid soccer right now and limit activities such as school and work as best as you can. Avoid alcohol, any drugs, avoid sleeping tablets. Do not use aspirin or anti-inflammatory medication. Do not drive until you're cleared, and you're going to return to sport once it's cleared by a healthcare professional. So I know that your mom is here in the stand, so I'm just going to talk to her and kind of make sure we're all on the same page, and she's going to drive you right now just to get a further examination.
Okay.
Okay, do you have any questions about anything?
No,
Okay.
thank you.